Alright, welcome to the Dr. Cause Show. Alright. Gonna grab his larynx, stabilize it with my thumb and middle finger. With my index finger, I'm gonna feel for the cricoid cartilage. As soon as I have it, I'm gonna make a vertical incision, probably a good deep an inch down. I'm gonna stick my finger in, feel for the cartilage. Make a horizontal slit, turn it 180 degrees, make another horizontal slit. Stick my finger down in, insert a bougie behind my finger. Stick it down until I feel it stop. Number 6 ET tube. Insert a couple centimeters. Draw, inflate the bag, and change it over.
Of course, when we do this surgical airway, any surgical airway, so there will be a complication. As we also, know here, there is a study mentioned about the roughly about 30 to 13.4% of the complication happen when we perform the surgical airway. And the most frequent early complication was incorrect performance of the procedure, and also can lead to the airway structure. And of course, other complication is the laryngotracheal injury, pneumomediastinum, pneumothorax, the bleeding itself, as well as the subcutaneous emphysema. Other things that the complication that they noted is the Bougie trapping, especially those who are using scalpel, and without using the finger, they put a scalpel and then they insert the Bougie. So there will be some a tear inside the Bougie. So when we put the ETT and we want to pull out the Bougie, there will be what they call the Bougie trapping. That's why it's very important for us to look at this when, especially always check for the integrity, especially when we use the scalpel alone. That's why the advocate use the scalpel and then finger and then plus Bougie. Okay. So how about the training? So what they advocate, at least 5 attempts or until cricotomy time is 40 seconds or less. So mastering about the surgical airway, and performance fit with the Melkel-Sandike cricothyroid set has been demonstrated after 3 months. So I hope this course will be another 3 months, 3 monthly to do that. No, just kidding. So you mean the simulation training? So you have to adequately perform, yeah. And before I end, this is very short. One more thing that we need to consider. Most FONA surgical airway will perform at the point of cardiac arrest or death. So in over 60% of cases, a surgical airway was obtained but was too late to avoid a poor outcome. That's why we have to lower threshold to perform surgical airway, because they found that from the study, especially from NET4, reported that when we perform surgical airway, patient actually already late. So that's why the recognition, I think Prof. Fahmi highlight about the, we have to admit not only difficult airway, but a failed airway. We have to, aware of this failed airway, and then we intervene early. So before I end, post-FONA is also very important. You can look at here the few things that we need to consider after we perform the surgical airway. And I guess, I think that's all from me. Take home message, plan, okay, double setup if you want to perform surgical airway, train yourself, self-train, use scalpel Bougie technique, and of course, pray hard. Okay, pray hard. I think that's all from me. Thank you so much.